All right, everyone. Thank you for coming to the PC 730 live library session. I am your faculty member, Nisa Meyer. I'm course faculty in all of the DNP clinical courses. And then, of course, we have our librarian, who most of you, I would imagine, know at this point, our Billy Ann Gebb. So we are here to talk about our projects, to kind of learn from one another, to have a little bit of time working on each project, trying to solve the problems that you haven't been able to get to the end of yet. Things like maybe a particular piece of information that you haven't been able to find that might tie some of your things together. Sometimes just the right search strategy can make a big difference for you. So I'd like to start off by having everyone introduce themselves. Just say who you are, what your project is, something real quick.
I guess I go first. I'm Shamir Clark. I'm a women's health nurse practitioner. I graduated from Frontier about 3.5 years ago with my MSN, and I'm working on perinatal drug screening.
I'm Jennifer Schultz. I'm a nurse midwife. I graduated from Frontier as well, just last November. And I am working on implementing skin to skin, kind of along with the delayed bathing piece.
I'm Taylor Johnston. I'm a nurse midwife and women's health nurse practitioner, graduated in January from Frontier, and I live and work in Haiti, and I am doing a project on exclusive breastfeeding for 6 months. So putting some education and hopefully a toolkit and some guidelines in place to increase our breastfeeding rates.
And I'm Becky Wagshaw. I'm a midwife. I graduated from Frontier about 1.5 years ago, and my project is looking at LGBT health and improving access.
Awesome. We'll have all midwives and women's health related topics today. That's it's always sort of nice if we have either all one or a good balance. I hate for any one specialty to feel sort of like they have no idea what we're really talking about here. So that's awesome. All right. So at this point, you guys should have each done at least 20 hours or so of your literature search. You've kind of done a deep dive. You know some things about your topic. But a lot of the time you can feel a little bit sort of overwhelmed or lost in the wind at this point about where we're really headed or what kind of information you need or where to find that one thing that will pull it all together. So did anyone come with a question they want to start off with?
We do have a question about really the quantitative versus qualitative studies. And really, I mean, I Googled it obviously, but just really defining it for me, and how do I find those exactly? How do I know what they are?
Okay, well, we are, Nisa, you jump in here if there's more you want to explain on the types of studies. But really, you know, there are some ways that you can narrow down your searching. But really and truly, the best way is to look at each article and look at their methods. So if it's a quantitative article, they're going to have measured something. They're going to use numbers to have measured something. Whereas qualitative is going to be more about people's experiences or their feelings or, you know, how they felt when something happened, that sort of thing. So in CINAHL, if you use the CINAHL database, they have subject headings. They have one for quantitative studies and one for qualitative studies. So you can use that, especially like if you just have a ton of stuff and you need to narrow it down, you can definitely use those to help get started. But the thing is they're not always used consistently. And so, you know, you need to be, you have to, you may, you know, there may be something you're missing if you use those. Then Medline doesn't use, they don't have those subject terms. They don't have limiters for that. You know, you just have to look and look at the method. So do you want me to do a search on your topic and we can kind of look at some articles and talk about what type they are?
Sure, if we have time.
Yeah, that's kind of what this is about. Is we're going to spend maybe 15 minutes or so on each topic, kind of looking up some things. If you guys, depending on what search techniques you've used so far, sometimes these things can make a big difference. Like if you're not using mesh tools right now, that can make a huge difference for you. That kind of thing.
Yeah, and Jennifer, I'm actually I was really excited when I saw your topic because I used to use this. I used to use the skin to skin as an example of the difference between CINAHL headings and mesh terms. And mesh finally got their act together and got a term for kangaroo care, but because for a while they didn't even have it, and whereas CINAHL did. So, and that's that is kind of the difference. CINAHL is much more nursing focused, and we'll have a lot more things like that. But so if we're in Medline, which I am, let me start all over here just so you can see what I'm doing. I actually have Medline and CINAHL selected. So I'm sharing my screen. So if you click on my little box, that should make it to where you can see it the whole time. But first, so when you have two databases selected up here under subjects, you'll have a choice about which subject headings you want to use, because like I just said, they can be a little bit different. So let's use the Medline ones first. And again, for skin to skin, I'm not sure, because I just happened to know that it was kangaroo care. I think if you look up skin to skin, you'd be kind of at a loss.
Yes, that's what I discovered. But I did find the kangaroo care, I think, under the mesh term.
Okay, great. Yeah. So yeah, you kind of have to know. Sometimes mesh will tell you what an alternate term is, but in this case, you kind of have to have a clue. So they don't even so if I search for kangaroo care by relevancy ranked, it will tell me what they use is kangaroo mother care method. And if I wasn't sure that was exactly what I was looking for, I could come over here and look at the scope note. And so it's a method of continuously holding the baby to your chest, involving skin to skin contact. So yeah, so that is what we want. So I'm just going to go ahead and select it. Now we will browse additional terms. We want to get the idea of breastfeeding in. And so breastfeeding, of course, they use the space. Now, when you select the term, you want to sometimes, you'll want to kind of look at you want to look at this used for, because I looked. Okay, let me back up a minute. I'm getting ahead of myself. So with breastfeeding, let's click on it. And we can look at the tree view. And so the tree view shows us how our term relates to other terms. So like feeding behavior would be broader, would be a broader term. And then underneath that, we've got bottle feeding, we've got breastfeeding. Underneath breastfeeding, we've got breast milk expression, which is more specific. And so I kept thinking, well, what about exclusive breastfeeding? Like there's nothing that really gets at that. But when I looked over here at the used for, this is used for exclusive breastfeeding. So it's going to encompass that, even though it's maybe not quite as specific as you need. So here again, this is a little more general, but this is a good place to start. Kangaroo mother care method and breastfeeding. So we'll search database, and I thought, oh, here we go. Yeah, when I did this and I pulled up this number 2, improving exclusive breastfeeding in an urban academic hospital, I was like, okay, well, I can go home now. Like this, this sounds right on. So you may have already found this one, but let's look. And so that wasn't the point, because your point was more about the what are we going to do? Or your point was more about, is it quantitative or qualitative? So another thing I always recommend is to look at the mesh terms that they've used to see if there are other ones that would be closer, or would help with our search. So breastfeeding, they've used health promotion. They've also used quality improvement, which is great because this is a quality improvement project. So let's look at their methods. Okay, they did a key driver diagram and plan, do, study, act cycles. Improvement activities follow the 10 steps. Okay. And then in the results, we demonstrated significant improvement in the median adherence to 2 process measures, rooming in and skin to skin after delivery. The proportion of infants exclusively breastfed at hospital discharge in our facility increased from 37 to 59%. So, to me, and Nisa, you jump in here. This is a little different because this is a quality improvement project, and so it doesn't fall into the standard quantitative versus qualitative quite as much. But to me, I would say this is quantitative because they've measured the the rates of exclusively breastfed at discharge, and it increased over 20%, which is awesome. But to me, there is a quantitative measure here. If it were qualitative, it would be more like, we interviewed the mothers and this is why they said they did or did not breastfeed, that sort of thing. Does that make sense?
Absolutely.
So let's look at, so that article looks really great, but let's just look at a few more to see if we can get to that whole issue.
If you are looking for a qualitative study on this and you're having trouble finding it, you could look for something like kangaroo care and then mother experience or something like that, like as a keyword, using mother's experience as a keyword, and see you are likely to get something more qualitative with that.
Right. And so this one, like right off the bat, like in the title, it says this is a randomized control trial. But the other thing that, so this is what I was talking about. That other one didn't give us all that, it gave us a number, but it didn't do this huge amount of statistics where it quickly gets over my head. But this one does. Like you've got higher proportion of neonates were exclusively breastfed in the control group. And so see how they've got a p-value, they've got this relative risk, confidence intervals, all that. This one is definitely quantitative.
Right.
Okay. So let's go just to show how there is a difference. So we did this with the mesh terms and we got 56. The CINAHL heading is a little bit different. So they just call it kangaroo care. And so the breastfeeding term is the same. But now they have, so you see when I do relevancy ranked, they have some other things that didn't show up in the tree view, but that you might want to try, like breastfeeding promotion. That one is kind of interesting to me. I had not used that before, but that's, in a way is kind of like what you're talking about.
Oh, there's even an attitude to breastfeeding there. That
yes,
kind of thing might be interesting.
Yes, and attitudes to breastfeeding. I noted that one as well. So let me do this one. Yeah, so this is 198. Okay. EBSCO doesn't like it when you do the back button, so kind of do as I say, not as I do on that. That might mess you up, but what I want to do is use that qualitative. So again, this is only in CINAHL, but they do have a subject heading for qualitative studies. So we can add that to our search. So now we've got 3 subject headings. And yeah, see, that takes it down to 7. And so that's why I don't like to use it right off the bat, because I want to see, are there articles or at all, or are there just not qualitative ones? But so this one, you'll see right off the bat, there's no numbers in the abstracts, but it says, the purpose was to comprehend the meanings. Data were collected through participant observation and interviews, that sort of thing is what makes it qualitative.
Okay. Perfect. You totally covered my question.
Okay, that is good.
That's a really interesting use of the word precocious there. I'm curious about what they are trying to say.
Yeah, precocious skin-to-skin contact, but meaning... The meanings, data work.
I don't know. I'll have to look it up. There must be an alternate meaning of precocious in the way I use it, because I wouldn't have used it there. So anyway, we'll move on.
Yeah, unfortunately, we don't have the full text of this one. It's from Brazil. Maybe there is a translation problem going on. I don't know. Yeah, interesting.
So did all of you already know how to use mesh terms and what is the CINAHL equivalent?
CINAHL headings. It's not as clever. Yeah.
It's not as clever. Has everybody already used those in their search?
Yes.
Yes. Mm-hmm.
Great.
Awesome. So what about anyone else? Any sort of holes in your search so far, or anyone having issues finding a financial piece, a sort of look at what the cost of doing or not doing your thing is?
I haven't actually found anything as far as financial stuff goes.
The only time I found something somewhat related to financial was when I was looking at, I think it was like the initiatives, where they're trying to kind of identify how much drug use costs, the state or of Virginia, but not specifically related to drug use and pregnancy.
So for yours, I think I don't know what we'll find for drug use and pregnancy. We should certainly look, but the cost of the NICU admission for the withdrawal symptoms in the baby, NICUs are sort of notorious for being where hospitals make their money. So I think when we're looking at like a state payer like Medicaid, it would make a really dramatic difference for them. I think I have at least enough of a hunch on that I bet there's something out there that would help us to figure that out.
Like for like NAS. Yeah.
Right.
Mm-hmm. I'd have one question, and it's like a app versus EBSCO question.
Okay, it's a what versus EBSCO?
Like the EBSCO app versus the EBSCO on the web. So I did a search on the app, and I have all these articles saved in my favorites. But when I log into the EBSCO host on the computer, none of those articles are there.
Okay, I have not ever saved any articles in the app. The app is very, very limited from what I understand. So my guess is, let me see if
I mean, I can print it out. I'll have the link to all the articles. I just didn't know if I was like missing something because I couldn't find my favorites in the actual web, like the web.
Okay. Let me. All right. So here's the thing. In the web version, they don't use quote unquote favorites. When you put articles in your folder, let me. Okay, wait, hold on. Oh, I do have the app. Hold on just a second. And it says my recent search was breastfeeding, so we'll just stick with that. So I take it that in the app, you just like hit the star.
Yes.
Yeah. Okay. So have you signed up for the My EBSCO host account? Like, does this?
Yes.
Okay. So see, in the app, you're not like, you just get that. The app is not, to make a long story short, the app is not connected to this account. Like the app never asks you to sign into this account. So it has no way of knowing. And so I don't even think it's an option. Like it just doesn't have that functionality.
Okay. Okay, good to know. I won't start anything else.
Yeah. I mean, I know it seems like that should be something, that you should be able to do, but I just don't think it does. Again, I have not tried this out, and it would be a little more difficult because you would have to sign into the proxy server, but they may have made their website responsive so that you could just, if as long as you had web access, you could go you could use the link. I haven't tried that either, but
Okay.
that might give you better functionality than the app.
Okay. Thank you.
Sure. Did you have another question?
Well, one of so I use the mesh terms and the headings in the search. And one of the things, like I was trying to find alternate words for perinatal, and I was using pregnancy as one of the words. And then drug use came up as like substance use disorders. And that was like the term for that. But I didn't want like substance use disorders. So I had a little bit of trouble trying to find something as another search option for that.
Yeah, that's why I was looking at this just before you asked the question, because I heard you before we got started say that, you weren't going to be doing, I assume UA is urine analysis.
Yes.
Because when I looked at your PICO form, I was like, okay, the term here would be substance abuse detection, because you said you were doing a screening. And then I heard you say that. And I'm like, oh, I don't think that's the right term, because that's, that's basically basically urine analysis. And I looked at the tree view and I didn't really, I didn't see anything else. And so, yeah, substance abuse, they say use substance-related disorders, which is disorders related and so then so then narrower than that is like all these different.
Right, and I clicked all of them, and I got like 88,000 results.
Yeah,
like,
yeah.
No,
so tell me a little bit more about what it is. So you're thinking, so not people that are abusing drugs, but are more casual users? Like, what's the difference that you're looking for?
So as a part of our new OB visit, we asked patients, are you using drugs? And that's the extent of our question. So wanted to use something like it's called the 4 Ps. It's a tool that you can use to screen for risks for drug use in pregnancy. So I've done searches. I found the 4 Ps as a search option, as a tool, but haven't really been able to find any other tools to use or, that are validated tools that we can use in the clinic other than the 4 Ps. So, that's
okay. So you want, so it's not the issue of the drug use itself. It's something about the screening.
It's screening for drug use in pregnancy.
Okay.
And then it'll be, to screen for it and then maybe provide a brief intervention or a treatment or referral for services. So, so a lot of the articles that I found, like there was one really, really good article that I found that was like, I have it here. It was the role of screening, brief intervention, and referral to treatment and in the perinatal period. And it talked about substance use and screening. So that's like my, kind of like has been my guide in trying to navigate my searches based on the expert kind of model. So
okay,
does that make sense?
Yeah, I think so. So SBIRT comes up a lot when we do these sessions, and there's not a mesh term for that. For SBIRT, you really can just type it in as the acronym because they'll usually, use that. So really, this is a case where, you may just have to use the keywords and kind, and then kind of work backwards. So I didn't, like I said, I'm working backwards. I didn't want to make it too narrow to start out with.
Yeah.
Well, is this the one you already have?
I do have that one, but if you put in, like, take out SBIRT and put screening.
Okay.
Sometimes that.
So I just want to look and see what terms they've used here. So they had, let me see make sure what state. Okay, this is in Medline. So they've used pregnant women. They have used prenatal care, and they've used mass screening, because mass screening can relate to a drug screening as well as, you know, any other sort of screening. So just wait, let's write that down. So pregnant women, which pregnant women. Okay. So just from what I have here, you're saying change the expert to screening. Oh wow, there's quite a bit of these. I'm a little surprised that there are so many.
So I was able to get some really good articles based on that. But when I narrow it down, you know, it's like it's one or two articles.
Right.
But
okay, well, let me try. Okay, so let's try pregnant women.
So right now, are you looking for, Shamiri, are you looking for the best, like the best kind of screening tool to use for pregnant women?
yeah, well, yes, I think that's definitely a part of it, is to find a validated screening tool to use in the clinic.
So you might consider just really looking at what does the literature say on screening like this for non-pregnant people, because the questionnaire would likely cross over.
Okay.
Here's one from Obstetrics and Gynecology Clinics of North America. Do you have that one?
I think I do, yes.
Shay? Okay. Because these look like they get a little old, because that's only so in case you guys didn't know, they will put your results in reverse chronological order. So the newest ones are on top. And so that one's only number 3, and it's already back to 2014.
Which is crazy.
Antenatal, I'm sorry?
Which is crazy, because with all the opioid, you know,
absolutely,
screening, like everything I found is actually pretty old.
Yeah.
There's not much new data out there.
So that one right there, is that what you have already, that antenatal risk questionnaire? That might be interesting to look at.
I don't know if I have that article, actually.
Yeah, it's from Women in Birth. And so I was looking at this before when you were talking about at risk. There is this term risk assessment, and I would be, you know, I'm a little wary of that wouldn't be a cure-all, but that's another one to try.
Okay.
But yeah, so antenatal risk questionnaire, ANRQ.
Okay.
It looks like this may be more of a risk for depression kind of tool, but you'd have to look at it a little bit more closely and make sure that
it does look
it may do both. But
and some of them
questions relating to drug and alcohol use and domestic violence.
Right, I see that. And some of them do mesh it all. You know, because the data is showing that there is a correlation between some psychosocial stressors and drug use in pregnancy. So some of the articles do have psychosocial issues within the article to include drug and alcohol use. So.
Well, and you'll just have to consider that for your project. It may be really efficient, actually, to kind of do an all-in-one.
Yeah, and I just want to point out, so because you were, you know, because we just got, the faculty just got sent something today about, you know, and I saw something recently too about, you know, babies being born, you know, opioid addicted, or the medicine they give the mothers to try and get them off the opioids is, you know, So what I noticed was when we did, when we used the keywords and didn't use any mesh headings, there were some about that. And so another thing to keep in mind, like I love using the subject headings and it works really well, but it does take longer. So when the articles are first put into the database, they don't get their subject headings assigned right away. So like if you look at these that come up at the very beginning, they don't have any subject headings. So so now that doesn't explain why there was, only 3 articles from 2014 to 2017. But keep in mind, if you want the very newest, hot off the press stuff, you may need to do a keyword search in addition to using your subject headings.
And I'll just say, I did find more articles on the web base than the app. I don't know why. I don't know. I use the same terms, but not all the same articles came up in the app than it did on when I sat at the computer and did it. So.
Right, and that might be the way some of the settings are set or something about how many to return or something like that. I'm not sure, but yeah, this women's opinions of legal requirements for drug testing, and that would but that's that's not the kind of thing you're talking about. I was going to say that would be a good qualitative one because that's looking at the opinions of the patients themselves. So yeah, I mean, most of you, like we were saying earlier, most of you here's public health response to opioid use in pregnancy. Yeah, most of you guys have topics that are pretty well covered, and you'll probably run into the problem of too much information rather than not enough. So again, which is fine, but yeah, so there should be a lot of stuff out here, but you'll just have to, you'll have to sort through it a little bit to see, to see what best fits your specific situation. Here's ethical. Here we go. Well, so this is neonatal abstinence syndrome, which you didn't, but ethical approaches to the identification of pregnant women who use drugs. So that part is good. Yeah, they've used the ethical issues subheading with that substance abuse detection. So that's, yeah, so now this, okay, so this is interesting. So CINAHL, and again, I had both databases selected. And so since we were doing keywords, it's going to draw from both, it didn't matter what the subject headings were. CINAHL has this instrumentation field. And so this shows the instruments that they use. Now these don't necessarily look like, from the name of them, they don't really look like drug screening tools, but if you read surely you don't have to go directly to start looking up these instruments. You can look at the article and see how they mention them and what they talk about, and see if that's going to be applicable to you at all.
Can I filter my search based on the instrument used?
Now that is a really great question, and you can do that, and let me show you, because somebody else, and actually I think it's the person who's not here, her PICO mentioned the PHQ, which is what patient health questionnaire or something like that. You can do that, but it sometimes gets a little hairy. So let me show you. Okay, so you've got this blue bar that goes across the top. When you click on more, you see indexes, and then you can choose which one. So now Medline, again, they don't do that instrumentation field, but CINAHL does. So then when we get to this screen, we're going to say we want to look only at that instrumentation field, and now we can browse for. So what was the one you mentioned earlier?
4P.
Yeah, see, I don't know what that will be. We can try it this way. Okay, let's try typing it out.
I wonder how it comes up.
Oh, wait, sorry, I did the wrong. Why didn't that work? There we go. 4 point.
And it's like 4 P's, like the number 4 P and then capital S.
Okay. See, this is why this only sometimes works. So 4.4 question.
Yeah, it's not fun.
So let me just show you with her, like with that other example. So like when we do patient health questionnaire, it's in here all these different ways, which like this is obviously the main one because it's got 1,300 records, but really so this as a librarian like makes me furious, like because like the indexing, you know, there shouldn't be problems with this. So when I looked at this one, I was like, geez, it's just easier to search that as a keyword than to try and use this. But this does exist, but hold on, let me Google that and see if I can come up with a
So I just did, and what I found is the 4Ps plus, which it looks like is a copyrighted screening that you'd have to. Is that your kids? Look how big they are.
Wait, sorry. Oh, were y'all seeing my?
Just for a second.
My desktop. Okay, sorry about that. But yeah, they're huge. That picture's even old. They're huge. Okay.
Okay. So it looks like it's one that you would have to pay for, and according to the 4Ps plus, if they are correct, they say that it is the only validated screening instrument specifically designed to quickly identify obstetrical patients at risk for the use of tobacco, alcohol, or illicit drugs. So if we believe them, they would tell us to stop the search.
I was gonna say, I think I wouldn't. I think I would just use. Oh, I see that.
It's in an article. It's by Chastoff. It's C-H.
Yes.
Chasnoff, and it's 2007 is the article year.
Oh wait, that's so because when I Googled that, it hold on, I'm just looking for the PMID. The PubMed record for an article by that same person came up, but this one is 2005. Is this what you were looking at?
No, well, yeah, that's one of them, but yes, that's the tool. And then there's another article that's validation of the 4Ps plus.
Oh, yeah. I gotcha.
Yeah,
okay.
It looks like they published about 4 times.
Yeah, I was gonna say they probably published subsequently to do the validation. So, oh, but you have to purchase it, so that may not. I mean, you may not be able to. Will you be able to do that?
Yeah, it's not cheap.
I didn't realize you had to purchase it.
Yeah. If you're doing less than 2,500, if you are seeing less than 2,500 women per year, then the fee is $2,500. And it goes up from there.
So you have to purchase like the actual, like copies of the screening tool.
Right. They have copyrighted it. So while it is technically possible to use the screening tool without paying them, it would technically also be illegal. And then you wouldn't be able to publish your results.
Right.
Well, there's some information about the cost of carrying out your project.
Right.
Right.
So, yeah.
What I would consider, so remember that we are not doing a PhD project here. And so if we were doing, I heard a really funny analogy today about PhDs being like baking, like where you have to control all of the, control everything perfectly. You need exactly the right amount of baking soda or whatever. I don't know. I don't cook or bake. But then the DMP is a lot more like cooking on the stovetop. You throw in this, you throw in that, you change it up, you taste it, you decide you want to add a little bit more of this or that. So for a DMP project, it is entirely possible to write your own screening tool, even if it is not validated, because you would be able to say that similar tools have been validated in the past, and this is the tool that seems most appropriate for your environment, or something like that. It's not ideal. The ideal thing is to not invent a wheel that's already been invented. But it may be cheaper than paying for a wheel somebody else has written.
Right. Yeah, exactly.
Yeah, let me take this opportunity to another thing that we usually show. Okay, so Google Scholar. So if you go into Google Scholar, which is just scholar.google.com, and I'm going to search for that. This is the 2005 article. I mean, you know, you can do it for whatever. I'm going to search for this article. You know, I'm not a robot. Oh, sorry. This makes me nuts. I don't know why I have to do it. Okay, so here's the article, which of course we already know, but what I'm looking at is then it will come up here cited by 75. So perhaps, you know, so these are articles that have cited that article in there. So perhaps somebody else, you know, came up with, you know, their own or whatever based off of this, and that might be a way to find one. Here's universal screening for substance abuse at the time of parturition. There's the validation article, which obviously they would have cited the original one. Mm-hmm. Here's development of the substance use risk profile pregnancy scale.
Ah, that might be good.
Mm-hmm. Yeah. Yeah, and that's in obstetrics and gynecology. A modified tweak.
That's good.
Yeah. Yeah, so I mean, I would look at that, but yeah, I don't want you could really go down a rabbit hole, I'm afraid, with spending a lot of time looking at scales.
Yeah.
Okay, so anything else you want me to try from here?
No, I think I'm okay.
Okay.
Thank you.
Sure.
So one thing I would like to look for, Billy, and I'd like to look for a financial impact on LGBTQ access to care for Becky, because that one seems like it may be a little bit of a challenge.
Okay. Yeah, and so I have to say, I'm going to just geek out here a minute. Becky, I don't know if you found this when you used the mesh terms, but for this one, like I just typed in LGBT, and so it came up with sexual minorities. And so I selected that. And so now I always tell people like, oh, you know, you can go over here, you can look at the history notes and the used for and blah, blah, blah. And I'm sure they never do it. But with this, it's fascinating. Okay, so this is a brand new term. They only they only introduced this mesh term this year. So before this year, they had all the, you know, they had a term for bisexuality, they had a term for homosexuality, you know, they had all these different things. So, and just to emphasize that, like, if you just search on this sexual minorities and nothing else, there are only 290 articles because they don't go. So when they introduce these new terms, they don't necessarily go back and re-index everything like they might for like maybe the past couple of years or something. So like these articles only go back to 2014. So what I did, and I can send you this, when I was working on this today, this was the best way for me to capture it. Disregard that vaginal smears thing. That came up and I clicked on it. So, but what I did was, so I had done sexual minorities and mass screening and only came up with 5. So what I did is I looked at that used for, sorry, I shouldn't move that. But anyway, these are all the terms, sorry, that these are all the terms that sexual minorities replaced, bisexuality or homosexuality, female, or, you know, and so when you do that, like there's over 20,000 of them. Mm-hmm. Compared to the 290 with just the sexual minorities. So then once I had saved this, I was able to add mass screening. And then how did I narrow that down further from there? Oh, then I changed it from major subject. I'm sorry, from hold on just a second. Sorry. I changed it from, oh, this is going to screw up my history, but that's okay. Oh, I changed it from subject heading to major subject heading, and so then that narrowed it down some too. But yeah, I can send you that. But that again was fascinating to me because of the new mesh term and everything. But what you can do when, let's just go back into mesh here. What you can do when you're looking for the financial. And so again, if you're going to use all those different terms, you'd have to go in and do them all separately. But there is this, there is, so a lot of, okay, can't seem to find it. So notice that the subheadings are different depending on what term, because not all subjects have the same subheadings, you know, because it may not apply. But so for many terms, there is an economics subheading. So again, I did all those terms for the sexual minorities and mass screening, but it almost seems like screening isn't necessarily, it's about the access to care. So I want to see if now that I've heard you describe it yourself, I want to see if there's a term for that. Health services accessibility. Oh, yeah, this will work. Okay, so health services. And this does have economics. So, Nisa, say that again. When what is the economic impact of the fact that of them not having access to care? Or
I think ideally, that's probably what we would want to see. I think that may be a little bit of a stretch. So it doesn't have to be exactly that, but we are asking all of the students to review an article that has to do with the economic impact of their problem.
Right, right. And normally I recommend using that economics subheading, but I'm afraid that putting it on this term is the wrong place to put it. If that makes sense? There's also healthcare quality, access, and evaluation. Okay, well, let's try this and see. I'm going to try this by itself, because sometimes, especially with subheadings, yeah, okay, so there's a ton of stuff with that. And then I'm going to save time, I'm going to copy this and see if I think that will work. Okay. Well, this is barriers to healthcare among adults identifying as sexual minorities, a U.S. national study.
That looks like a really great article. You'd have to really get into it to see if it talks about financial impact, but
right.
Okay, it looks like maybe financial, maybe that was one of the barriers to care.
Oh, I'm sorry. Did I go too quickly on that?
That's okay.
5 barrier to care outcomes were assessed, delayed, or did not receive care because of cost. Yeah. Did not receive services because of cost, delayed care for, yeah. So yeah, definitely that would be a part of it.
And in order to talk about that in your project, because you may need to at some point talk about that in your project, then if you're able to find a study that says exactly what you need, then great. But if you're not able to, then you would say, look, cost has been identified as one of the barriers to care. These are all the other reasons that LGBTQ folks don't get care. Like, these are all the access problems. And we know that when people have limited access, that they don't seek preventive care. And here is the financial impact of not having preventive health care. So sometimes you have to kind of, make a little bit of a leap.
Oh, you know what? I just, I was at a conference recently and I was talking to some colleagues, and again, so you guys are really getting to see the librarian geek here, but you can float a subheading. So like there's a way that we could put in economics, meaning like we want to, like, it doesn't matter which subject heading it's attached to, just as long as it's a subheading of something. But I'm not sure that EBSCOhost will support it. I'm going to... Okay, I'm going to try it, but I don't know that it'll work. Oh, it did work. This is so exciting. Okay. So if you see what I did there, so like economics was the subheading to comprehensive healthcare. So even though we didn't use comprehensive healthcare in our search, we got it because we were looking for economics. And I'm not sure what's HCV?
Hepatitis C.
Hepatitis C. Okay. So like that, while that's a little more specific than what you were looking for, it does look like it's, kind of, because that's the value of doing that treatment. Okay. That's the one we looked at before. And then this one, just in case you guys didn't know, whenever you see those brackets, that means it's in a language other than English. So that would probably not work. This one appears to be like a reply to a letter or something. This might be interesting. Prophylaxis, accessibility research. The state of transgender healthcare policy.
It's kind of old, but that disparities in health insurance coverage, access, and outcomes.
That's what I was just looking at. Yeah. I mean, that looks like it's gonna some tables and stuff here. Oh, and that's another thing. There is also a statistics and numerical data subheading. So again, economics is probably more on point there, but I see that this has been used, that statistics and numerical data. So
one thing to point out about the age of articles here, in a lot of things in this program, or throughout Frontier, you may have heard things about not using articles that are more than 5 years old, or those kinds of things. And while we don't want the majority of your evidence, to be 20 years old or anything, sometimes when we're doing these projects, we are only working with things that are really well known, right? Really well established. We're not doing new research here. We're not always looking for the most cutting edge. A lot of the time we're looking for things that have been really well validated. This is established medical knowledge, and we are just not putting it into practice in the real world. So sometimes in this area, it can be okay to have an older article because that's actually contributing to what we know about this topic.
Yeah, sure. And so like I said before, your results will be in reverse chronological order. And so just know that the further down you get, the older they're getting. But don't, that's why I don't like come over here and limit to last 5 years or even last 10 years. Because I kind of want to see, even if I'm not going to use some of those older things, I want to see what the body of literature is. And then again, like we just showed, we could look at that article, to put that into Google Scholar and see if anybody cited that, and maybe there will have been an update on it or something like that. So yeah, did that help with that one? Is there, you want me to?
Yeah, definitely. Thank you.
Okay, yeah, you're welcome. And so, yeah, so for those, so we used health services accessibility, and then there was another one. So there are going to be a few different things around that issue that you might want to look. Yeah, no, there's not anything specifically on barriers, but that might be a good keyword to search as well. So let me just pull that back up. So I did access to healthcare, health services accessibility, and then there's healthcare quality, access, and evaluation. And then there's healthcare disparities. Differences in access to or availability of medical facilities and services. I would definitely take a look at that as well. If you haven't
exactly
already.
what the project is about. That'd be great.
Yeah, and it has an economic subheading. And like I said, I will send you that that page where I've got all the
Thank you.
all the things listed out, and you should be able to just cut and paste it from there.
Thank you.
Sure.
So Taylor, I don't think we've done anything with your project yet. Anything that you want to look at?
Yeah, well, like I was telling you at the beginning of the call, the main thing I'm missing is just stuff that is really applicable to rural Haiti. So there's lots and lots of information about breastfeeding and all the different things you can implement to increase the rates. But I just wanted to find, as specific as possible. So as far as background of the problem, I couldn't really find anything or much as far as data, which I don't think anything would even exist locally, but even for the region. And it's probably because if it exists, which it probably doesn't, it's probably in French. But even I ended up what I found to get it as narrow as I could was just to find like breastfeeding and increasing breastfeeding and developing countries was like the closest that I could get as far as like a CINAHL heading or a mesh term. They both had developing countries. So
okay, that's great, because I had not used that term before, so I'm glad to know that as well. So I'm gonna show you what I did, and I don't know if it's more if it'll be better than what you already did or not, but let's just give it a try. So again, here I'm going to indexes, because Medline, and I don't think CINAHL has this, but I could be wrong. Medline has a geographic subject, and so I put in Haiti here. Browse, and so they have several records for Haiti. So I'm going to add that to my search, and then. So I just went ahead and searched on all. So then once I got those, I pulled up, and because I had done breastfeed, that MH means subject heading. When you go through this, through that mesh term interface, that's what it ends up doing, is putting MH breastfeeding. So I did those together, and I thought, yeah, like this first one looks good. Is that something you had found already?
That's a good
Uh-oh,
question.
did she get frozen?
No, I had to switch back because I was typing notes in a Google Doc, so I had to switch back to look at your screen.
Oh, I'm sorry. Yeah, so
No, that's
breastfeeding
okay.
practices and child growth outcomes in Haiti.
I actually don't remember if I found that one or not.
Okay. And then,
Below all are familiar. I've seen those
okay.
2 through 4, but 1, I'm not sure.
So like I said, you may, really, since Haiti is not that, it's a pretty, there's only one spelling and that sort of thing, that going through using that geographic subject maybe was not any better than just doing it as a keyword. I don't know. But, I thought I would show you that. And then, so you found developing countries, which is great. Oh, and you did see this one about, protecting and improving breastfeeding practices during a major
Yes.
emergency. Okay, you've got that one. Okay. The only other thing when I heard you talk is you could use rural, but I mean, I just really think that's going to be more about, rural areas in the U.S., which are, I'm guessing, a somewhat different environment than being rural in Haiti.
A little bit.
Yeah. So there are things for rural health. So I don't know if that will help or not, but that's an idea.
Taylor, tell me a little bit about what you're finding are the barriers to breastfeeding in Haiti that are different, because sometimes then we could explore some of those individual barriers.
Yeah.
I mean, just honestly, for our program, one of the biggest barriers that's going to be very easily remedied is the lack of breastfeeding education. Before I moved here, it was virtually none. So that's an easy obstacle, but otherwise, culturally, some of them are really similar to in the States. The belief that some have that breastfeeding is for the poor, and if you give formula or give a bottle, it makes you look like you have enough money to afford formula and bottles. And then the biggest thing to exclusive breastfeeding is even people who breastfeed also give food and water and juice starting almost immediately at birth, and they just don't believe that breast milk is enough. So I would say that's the biggest, because even the women that we can get to breastfeed, or the women that are already breastfeeding without needing convincing, they act like we're crazy when, if you tell them breastfeed only, they will laugh in my face like I want them to starve their baby.
Oh.
So I would, don't spend a ton of time on it, but I think it'd be really interesting to look back in time a little bit and see what the breastfeeding information and campaigns from the 80s look like in the United States.
That would be so much fun.
Yes. I mean, like I said, don't spend a ton of time on it, but it would be worth a few minutes to kind of think about, because I think in the United States, we have definitely met that tipping point where the average, mom can identify what the science says about breastfeeding being best. They may not, there are still lots of barriers, lots of other things that get in the way, but that is, in 1975, that was not true. Honestly, it wasn't true in 1980.
Right.
And from 1980 to 1990, I think that changed quite a bit.
Yeah, that's a good point. Okay, so a couple of things as I heard that. So just so you know, again, Medline doesn't have this, but CINAHL does. If you select breastfeeding, there is an education subheading, and so that will get you, and you probably have a lot of this stuff already, but just in case, that will give you kind of, consumer information, consumer education on breastfeeding. You'll get that with that subheading. The other thing is, I was looking at that supplementation, which we'll get to in a minute. The other thing is there is that, I think we saw it earlier because with somebody else's, but there is that attitude to breastfeeding term.
Yes.
Yeah, so I would look at that.
I
And
have
then,
done
yeah,
that.
that thing about supplementation, I mean, yeah, I'm with you, because even, well, we just, my twins are, they're almost 10. And when I told their daycare teacher that I wasn't going to give them solid food until they were 6 months, I mean, yeah, she acted like I was starving them. So I totally get that. So there is this infant feeding supplemental, but I'm not sure if that's gonna, I mean, I don't know that finding articles on that is really going to help. I mean, what that issue is, but just to let you know, it is there. So, I mean, you might what if, so infant feeding supplemental and breastfeeding, I'm just curious what's at the intersection of these two terms.
Oh, and I have another question for you, Taylor. So if you found patient education materials, do you need them in French, in Creole? Like, how does that work?
Creole. Yeah.
Okay.
Well, most of my patients cannot read. So the only people education material are going to help are my nurses. And they can read in French or Creole. Creole easier than French, but most of my patients can't read.
So having an informational guide for your nurses, though, may really help with the quality of education that they're giving out.
We had a nice long talk about that today.
So do you speak French? Or Creole?
No, I speak Creole.
Oh, you speak Creole.
Yes.
Okay.
Oui.
Yeah, that's a whole, so are you going to, so do you already have the stuff that you're going to give to your nurses
No, I do have four, they are patient handouts, about breastfeeding that, I think they're from World Health Organization in Creole.
Okay.
I don't know why I'm thinking they're from the CDC, but I think they're probably from World Health Organization in Creole. And they're great. And I actually found them months ago before I even knew that this was going to be the topic for my project. So actually, I might use them.
Okay, I was gonna, because I off the top of my head, I don't know a good, from our resources where to find that. But if you do need help with it, let me know, and we can explore that further.
Yeah, if you happen to stumble upon just like a database of patient education in Creole, I will pay you for it.
Well, yeah, okay. I know, I'm not. I know that probably doesn't exist. Well, we just looked at this, and I don't know that it had patient ed, but it had this whole it's like a point of care tool that has this whole section on I forget what what it was called, and I know a lot of times you hear that and you almost wince because it's like, oh, cultural perspectives, because it's going to be things like, they nod their head no when they mean yeah or something. But this was really healthcare focused, and so they might have a section, but I don't know that that would have patient. I don't know if that has patient ed or not. And so we have this. I hardly ever use this. I don't know if any students use this. We do have this Health Source Consumer Edition, but it doesn't have a language index. I doubt it has things in other languages. But we do have some sources for consumer health, but that's, well, anyway. So no, I will definitely keep an eye out for that.
Best Fed Beginnings, that looks pretty good. I didn't find that anywhere.
Oh, really? Oh, wow, you're right. That is. What about that? Oh, that's from pediatrics. See, I thought this is articles, but I guess more at a consumer. I thought it really had like handouts and stuff.
I used that in my search, and it was actually really good. I got some good stuff from there too, from Health Source.
Oh, did you? Okay, well, good. Yeah, a nationwide quality improvement initiative to increase breastfeeding. Yeah, well, this is why we didn't come up with it. Again, it's got subjects here. It may not have been indexed in Medline or Centol yet because it's very new. It's July 2017.
Mhm.
I have one more thought for you, Taylor. One of the issues you may run into is that your nurses may have the same attitudes about breastfeeding that the general population have. So they may also, or at least if nurses everywhere are somewhat similar, then one of the things we run into with American nurses is that they often hold the same attitudes and beliefs about breastfeeding that we are trying to encourage our patients not to hold. And there is some literature, at least out there, about how to get your staff really on board, how to convince your staff that that exclusive breastfeeding is better than supplementation in the first few weeks, or that pacifiers, or whatever, all the things that we think that you shouldn't do anymore, and that nurses who've been around more than a decade don't quite buy into sometimes. There may be things like that that would actually relate cross-culturally because it's the exact same problem.
Yeah, so look at this, incentive-based, which I know you can't necessarily give incentives, but incentive-based intervention to maintain breastfeeding among low-income Puerto Rican mothers. So again, not your population, but perhaps there might be some similarities there.
Yeah.
Yeah, historically fairly close. So
yeah.
Dominican population you could look at too, because
Yeah,
a lot of
absolutely.
patients migrate to the Dominican Republic. So, I mean, you might want to consider that.
Well, used to. They're not allowed anymore.
Oh, used to.
I did find some studies, probably more studies about the Dominican than here.
Okay.
So yeah, anytime your population isn't exactly the same, and honestly, every one of us will run into this with our projects, that exactly what you are doing in exactly your setting probably doesn't exist in the literature, or, you know, might, but not exactly the thing you want to see or whatever. Always think about how you can like cross-apply other pieces of information. So, you know, just like we're going to think about how we might use a questionnaire to screen for drug use in non-pregnant people, because that screening itself may not really change just because the person is pregnant. Or, you know, we're going to think about how we teach nurses to hold these beliefs about breastfeeding so that they pass those beliefs on to the patients, and how that may be, that teaching the nurses process may be something that happens similarly in different cultures. This is part of the DMP work that you're doing, because you are the only one in your environment applying all the literature to your environment directly. So you need to kind of pull from every place where there's an overlap. Kind of like Uno cards, you know. You got a red 1 and a red 8, but they're both red, you're going to use that. What about other questions? Anyone else have something they just really want to look at about their topic? Nothing else, huh? I have a couple things that I wanted to just sort of remind you guys of, or tell you if it hasn't, if you haven't quite gotten this yet. And I apologize that it's hard for me to know exactly what you need to hear today, because it's hard for me to remember, you know, right now the projects make sense to me, and I have 100% confidence that your project is going to come together perfectly, because I watch it happen all the time, and they do. So I don't know exactly how to impart that confidence onto you, but just know that I have it, and maybe that'll help you to grow it. The things that I want you to know is that, first of all, like, the needs of your population are the thing that comes first, right? So you're looking around at your environment and you're finding what your community really wants. So the healthcare providers in your community, they need to have buy-in to this. It can't just be that you want to do it. People in the site need to also be motivated about doing this. So it's going to be the needs of the site first, and then you go to the literature, which is what you guys are already doing. I've been a little bit guilty today of saying, like, what piece of information do we need? What are we looking for to tie this together? And that's actually kind of the wrong approach. What we should be doing is going into the literature and seeing what's there and being really flexible so that the literature guides us where the information goes, so that we are flexible, saying, you know, I want to improve breastfeeding rates and I'm going to go wherever the literature takes me, instead of deciding what those interventions already are and then looking for support for them. So don't take my example on that today. But this is, it is the better way to do this instead of deciding what you want and looking for evidence to support it. Once you have done that, then you're going to look for guidelines that support what what these things are. Like this guideline says, we're going to do these things, and maybe we're going to cross apply it from other disciplines or something like that, but we're going to figure out this is a good thing to do. Then you want to look for toolkits if they are at all available. Not every subject is going to have a toolkit, but there are definitely toolkits for helping to encourage breastfeeding. You're just going to have to look through them and see what about those toolkits might apply to Haitians. Or, for each one of your topics, you may find toolkits that you just have to then go through and kind of figure out, does this really apply? Will this work in my setting? And then from that point, you're going to go to your clinical site. You're going to look at your chart reviews. So you guys will be doing this in the patient tracer assignments and some of the other assignments coming up, but you want to look and see like, hey, this thing that I said needed to be done and the literature said needed to be done, is it being done? And can I prove that it's not being done? Can I show here that it turns out we are not even assessing whether LGBTQ folks have come into this clinic or not, or whatever it is that we should be doing. Are we doing that thing? And can I show that we're not doing that thing? And you're going to be talking to the clinic, building your coalition of support now, right? Because you want to get people on board now. You want to walk in on the first day of next term with a group of people who are excited and motivated and know something about your project. If you don't talk to them about it now, if you're not kind of getting some feedback from them on what you want to do and whether it's what you want or whether it's what they want, you may walk in on the first day and everyone sort of says, that form is way too long, I'm not doing that. Or whatever. There will surely be someone saying something. So the sooner that you kind of get everyone's support, the less they have to talk about. Any questions about that process, that like this is the general flow of what we want to see from you? That's good. Oh, we did not talk about at all was the IOM 6 aims. Does everyone know what they are? Have you been looking for them? Have you found things related to them?
I feel like they're really broad, like the aims. So I think the hardest part is like putting those search terms in and like not coming up with 80,000 things, like because drug use and safety, it's like.
For sure, yeah.
I'm gonna have 100
You may
things.
need to keep several of your search terms in. So, you may need to be, when you're already sort of narrowing your search to those articles that are most important, then stick in safety and see what you get there. That exercise that we're having you do for this checklist is really just an exercise. It's to get you thinking about the IOM 6 aims. But as you build the project, one of these aims is going to become central to your project. So pay attention to which one is sort of naturally becoming the focus of the project. Is this mostly a financial project? Is it mostly a patient-centeredness project? What exactly is it, an efficiency or effectiveness kind of project? What exactly is the project really, really going for? Because one of those words will be in your title. It will be something that all of your aims should work toward. Your aim should work toward, and all of your ramps should work toward. So you'll really have to narrow it down to just one of them. So keep that in mind while you're looking and kind of building a project. Little soapbox of mine, the word efficacy, it does not mean the same thing as efficiency. I just say this as many times as I can to as many people as I can. Billy Ann's laughing because I actually do say it as often as I can to as many people as I can.
Yeah, I'm just because I heard it yesterday, but I wholeheartedly agree. So go on.
It's a hard word, honestly. I don't really know. They should have just said effectiveness in the 6 aims. I'm not sure why they used efficacy. It is not a word that is in common use to the level that I think it should be in order for it to be used well. So efficacy just means effectiveness. So if you can't substitute in effectiveness in a sentence, then you're not using efficacy correctly. If you ever find yourself mixing up efficacy and efficiency, one is effectiveness and one is about using resources wisely. So be careful with that, because sometimes we see that in projects, students will kind of switch back and forth between the two words like they're the same, and they're actually separate aims, and it can totally confuse your project and spiral things a little out of control. Let's see, I have a list here. Let me glance through it and make sure we have hit everything else. So it looks like that was all the things on my list. Do you guys feel like you know what you're doing with your search? Like, do you know what you're looking for, where you're headed? You don't feel like we've just thrown you out into a sea of search terms just to figure it out and flounder?
Just a little. if we're being honest. But
yes, you should be honest, definitely.
but I feel like it's helped to, you know, like going through the different checklists, like doing the Medline separate than the CINAHL, and then choosing which databases I was going to choose. You know, I found different articles in each of those searches. So I think it does kind of, and I learned new things about searching, you know, using message terms, using the headings that I didn't know before. And honestly, that I wish I knew, like, when I was doing my WH&P program, because it would have made me looking for articles much easier than now. So, but yeah, so I mean, it's still, you know, a lot, but I think it is helpful.
I wholeheartedly agree with you. I can't believe I didn't know this stuff when I was in my master's program, and it irritates me now to think of all the time I spent searching that was so ineffective.
Yeah.
How I could have done a much better job. And my poor husband is about to finish a bachelor's degree, and like, he can't search for anything without me leaning over his shoulder going, look for the mess term. Like, what are you doing? Stop that. Like, he's learned some good search tips.
I remembered one question that I had.
Okay, yeah, go ahead.
I believe it was in one of the modules, but I think it was in one of the modules or the instructions about the EBPQ, and it mentioned the EBSCO Global Health Database. And I could not find that through the library website, but when I Googled it, so I didn't know, since it's an EBSCO database, I didn't know if the school, if I have access to it through the school or.
Yeah, that's not
No.
something we have access to. Can you tell me again where you saw that?
I don't know. I believe it was mentioned in the module in the course.
Okay, in module 2?
But I could be wrong.
Yeah, no, that's not that's not a database that we subscribe to, and so I've not heard of it before.
Okay. I mean, I found a lot, so I just wanted to make sure I didn't miss, you know, there's some way to get into it through the school, and I'd miss it if there was a way.
Oh, sure. No, I understand.
Probably found.
It does look like there's a free trial online.
Well, I tried that, and then it asked me when I would be ready to purchase and how many people were in my organization and wanted a card number.
Yeah, those generally aren't for
not for individuals, huh?
Not for individuals, yeah. What's it called again? Global Health Database?
Global Health. Mm-hmm.
I mean, we could get a trial, but then that would, you know, I'm just trying to find in the course where that would have been.
Well, I could probably look back and find it, but I don't know where else I would have seen it. I thought it was in the course, but it might not have been.
Yeah, if you come across it again, let me know. But no, that's a valid question. That's just, you know, that's one we happen to not subscribe to.
Okay.
Sure.
I'm just playing around on their website. I'm sorry.
now we all want that. Yeah, I'm surprised. I mean, surprised my EBSCO rep hasn't tried to sell it to me. Honestly, if it's that good, public health database. Oh, interesting.
That's interesting too.
Yeah. Okay. Well, yeah, I might. Yeah, I can look into that.
All right. Well, does anyone else have any questions? Anything they want to talk about? Any confusion we could clear up?
Do we know what happened to Kelly? It looks like she came in but then left.
I'm not sure. I sent her an email earlier, but I did not get a response.
Okay.
So we'll just see. Maybe she can join into another session.
Yeah. Yeah. Sure. Well, let me just say before before we wrap up that, don't feel like this is the only access you have to me or to the library. As you keep going and go through this, please feel free to call us if you need further help or want to go back over something we did tonight or whatever questions that you have.
Thank you.
Sure.
Thank you so much.
Billy Ann, I have to tell you, today I thought this would be the day where I did not learn anything new, but I didn't know that you could copy and paste from your history. So one more time. Yeah, one more time.
All right. Yes.
I'm telling you, I will be a master searcher someday.
You will, absolutely.
All right. Well, thank you guys for coming. This was fun. I
Thank
love doing these sessions. Like I said, I always learn something. And I look forward to having you guys in the course. So if there are things that you think of later or whatever, just shoot me an email. I look forward to seeing how these projects develop.
Thank you.
Okay. You guys have a good night.
Good night.
Good night,
You too.
everybody.
Good night.
Bye.
Bye.